Hi, today I will be talking about the anatomy of the human lungs. The lungs are one of the most important organs in our respiratory system. It is located in the thorax inside the rib cage on either side of the heart, resting on the diaphragm. The shape is narrow at the top, which is the apex, and wider on the bottom. It is made out of spongy pink gray tissue that occupies the majority of the thorax. Over here, you can see the trachea. It connects the lungs via the left and right bronchi. The mediastinum separates the pair of lungs. The right lung is shorter and wider than the left lung. It has three lobes: the superior lobe, the middle lobe, and inferior lobe. And then the left lung has the cardiac notch, which is basically an indentation for the heart. It has two lobes, the superior lobe and inferior lobe. Each lobe has multiple bronchopulmonary segments, which are basically the divisions of a lobe, and they have their own tertiary bronchus, which receives air and blood supply from its own artery. The main stem bronchi divides into smaller bronchi, which eventually divides into bronchioles that are even smaller. The bronchioles end in alveoli, which is where oxygen and carbon dioxide exchange. The function of the lungs. So the lungs work together with the diaphragm and chest muscles to inhale and exhale for airflow. Each lung has both respiratory and conducting zones. The lungs perform the exchange of oxygen and carbon dioxide through blood from the pulmonary circuit. When you inhale, air travels down to the left and right bronchial tubes. The oxygenated blood travels to the lungs to pick up oxygen to be distributed to tissues throughout our body. When you exhale, carbon dioxide, which is basically metabolic waste product, is removed from your body. The lungs also produce mucus to trap dust and pathogens. Some of the common lung diseases include asthma, chronic obstructive pulmonary disease, also known as COPD, cystic fibrosis, bronchiectasis, pulmonary fibrosis, lung cancer, and lymphangioliomatosis, also known as LAM. So, starting with the first common disease, asthma, it is a condition where your airway swells and constricts, filling the space with mucus. It is commonly triggered by factors such as allergies, cold weather, exercise, and strong odors. Symptoms can include difficulty breathing, tightness in chest, wheezing, and coughing. Over here in the picture, you'll see that the normal airway is pretty clear, so that provides sufficient airflow, whereas those with asthma will have inflamed airways, causing the airway to be constricted. That is the reason why people with asthma have difficulty breathing. And then the next one is chronic obstructive pulmonary disease, also known as COPD. It is an ongoing condition that is caused by damage to the lungs, resulting in inflammation of the airways, constricting airflow. Symptoms can include difficulty breathing, regular coughs with mucus, and wheezing. If you look over here in the picture, you'll see that in a healthy lung, the alveoli are perfectly round and the bronchiole is wide open for sufficient airflow, whereas those on the bottom with the disease, in emphysema, you'll see that the alveoli are collapsed. The airways are more narrow, and in bronchitis, the bronchiole is filled with mucus, and that is what causes the symptoms of difficulty breathing, regular coughs with mucus, and wheezing. And then next we have the cystic fibrosis, which is basically a genetic disease that causes thick mucus to build up in your body that can block and damage vital organs such as the lungs, liver, and pancreas. It affects the airways, which can lead to difficulty breathing and reoccurring infections. It can cause cysts and scarring, which is basically fibrosis in the pancreas, in addition to thick mucus that can block certain enzymes, which can cause nutrient deficiencies. Symptoms also include difficulty breathing, frequent wheezing, sinus infections, continuous cough, loose or oily stool, frequent lung infections, and failure to thrive. And over here, you can see that in the normal healthy bronchus, the airway is wide open. There is really good airflow. Whereas over here in the cystic fibrosis, the airway is clogged with mucus, which leads to poor airflow. And then next we have the bronchiectasis. It is a condition where airways either widen or develop pouches caused by damage to the airway walls, making it harder to clear mucus out of the lungs and more susceptible to reoccurring infections. Symptoms may include coughing out mucus, blood and or pus, foul-smelling mucus, shortness of breath, repeated colds, wheezing, and flare-up symptoms can include fever, chills, fatigue, and night sweats. So you can see over here, normal bronchus, there's a little bit of mucus and there's cilia. In bronchiectasis, the cilia is damaged and there is excess mucus built up in the bronchus. And then we have the pulmonary fibrosis. It is a condition where there is scarring and thickening in the lungs, which causes difficulty breathing. It is a type of lung disease that affects the alveoli. It can be caused by environmental exposures, such as asbestos, granulomatous disease, smoking, connective tissue disease, and medical treatments. Symptoms can include shortness of breath, dry cough, fatigue, club fingers, weight loss, blue, gray, and white skin surrounding the eyes, lips, and nails. So in pulmonary fibrosis, the healthy alveoli is soft tissue that expands with breathing. In pulmonary fibrosis, it's the opposite. The tissue is very thick and stiff. And then we have, this is one of the more wider known lung disease, which is lung cancer. It's caused by uncontrolled cell mutation division in the lungs that can lead to growths such as tumors or masses of the tissues that prevent the lungs from functioning normally. It usually starts in the alveoli, bronchi, or bronchioles. There are different stages 1, 2, 3, and 4. Smoking can increase the risk of lung cancer. So the symptoms include lingering cough, shortness of breath, wheezing, chest discomfort, loss of appetite, hoarseness, fatigue, shoulder pain, swelling in the upper torso area, drooping eyelid with minimal swelling on that side of the face, and coughing out blood. Lastly, we have the lymphangiole which is also known as LAM. It is a rare condition that causes growth such as cysts in the lungs, lymphatic system, and kidneys. It is caused by genetic changes, mostly affecting women between the ages 20 and 40. Symptoms can include wheezing, shortness of breath, cough, coughing up blood or chili, and chest. So in normal lungs, you'll see that, there's nothing blocking the airways, whereas those with LAM, there can be several lung cysts growing around the airways, which causes the airways to be blocked. And that concludes the anatomy of the lungs and the basic, the common lung diseases. Thank you.